Thank you, Dr. Chan. Please feel free to speak when you're ready.
Great, so welcome everyone. Thank you for joining us on this Facebook Live. I am pleased to be here today to talk about an update on COVID vaccination for children 12 and older. So as we all know, vaccination is key to protecting adolescents both in school and out. And we hit a big milestone this past weekend when we administered our millionth dose in Rhode Island. So very exciting. I think as people know, Rhode Island has been in one of the top 10 states in terms of doses administered and getting vaccine out to people. And I think it's a tribute mostly to the fact that people have wanted it. And as a physician here in public health, I've been really thrilled that so many people in the community, so many Rhode Islanders have wanted the vaccine. I myself, as a physician, as a Rhode Islander, have gotten the vaccine. I got the Moderna earlier on in January and February and have done well. So I'm really been thrilled. And we're moving now to vaccinating younger people. And I'm very excited to talk about that and happy to answer any questions. I want to be clear, there's no questions that are too silly or simple or etc. So please ask all your questions. We want to be direct and transparent and have an honest discussion with everyone. The other thing I want to point out is that adolescents do account for a growing proportion of COVID-19 cases here in Rhode Island and nationally. So it really is urgent that we get children, especially 12 to 18, vaccinated in the coming days and weeks, especially and ideally fully vaccinated for summer. One thing that does come up from time to time, and one silver lining of the pandemic, if there's been anything that's been a silver lining, is that children don't get quite as sick from COVID. And we recognize that. I still want to point out that there are still and have been thousands upon thousands of hospitalizations and deaths across the country in children, in adolescents from COVID. So while older adults tend to be affected more, children and adolescents for sure can be affected and can potentially die and have serious complications. So that is one reason for them to get vaccinated, as well as just the fact that children are often around older adults and other people that are more vulnerable. So to end this pandemic and put it behind us, which all of us are itching to do, we really need all children and adolescents and adults to be vaccinated. One of the advantages, of course, is that fully vaccinated people in general can participate in activities with low risk. And so, for example, fully vaccinated people without symptoms don't need to quarantine if they've been exposed to someone with COVID-19. And we anticipate locally, throughout the state and nationally, and even internationally, people who are vaccinated will be able to do more things and have less restrictions than people unvaccinated. So that's another reason as well. An update on the Pfizer vaccine. So most people who are listening have, of course, probably heard of the Pfizer vaccine by now, but just to update people on the data, the evidence, the science, in terms of what it showed among people, adolescents aged 12 to 15, they did study this in a group of adolescents, about 2,200 adolescents, 12 to 15. They actually found that the vaccine was 100% effective in preventing against symptoms with COVID-19, 100%, and that it led to a strong immune response. So in this trial of over 2,200 people, there were 16 cases among the group of adolescents who did not get vaccinated and 0 cases among the more than 1,000 adolescents that did get vaccinated. Furthermore, we know that the Pfizer vaccine is highly effective against the variants that are emerging, which is great news. And this aligns, of course, with what we've seen with the Pfizer and the Moderna and other vaccines in general, is that they are really, really safe. And so obviously this data among 12 and 15-year-olds is reassuring. So on May 10th, the FDA, United States FDA, reviewed the data, has been reviewing, and they issued an authorization on May 10th for the Pfizer vaccine for adolescents aged 12 to 15. So the Pfizer vaccine now can be used in all people age 12 and up. The adolescents, they reviewed all the safety data. So the adolescents in the trial, similar to adults, similar to other young adults, experienced mild post-vaccination symptoms. So similar to what I experienced when I got the Moderna vaccine. They had pain in their arm. They've had some malaise, fatigue. I developed some low-grade fevers actually after getting the vaccine. Lasted for a day, and then I was better. And that's what they saw in these trials as well. They'll also be monitoring all the participants in these clinical trials for longer-term protection and safety for an additional 2 years. I do want to remind people that the first trials for COVID with Pfizer and other vaccines began last summer. So we now almost have a year of safety data in people in general. And you know what? Again, I've been reassured that the safety looks great. For people that tend to have side effects are going to pop up within the first couple days or first couple weeks, potentially after getting the vaccine. So that has been reassuring. Yesterday, Wednesday, May 12th, the CDC acted on the recommendations of the Advisory Committee on Immunization Practices, the ACIP. That's the main CDC group comprised of vaccine scientists and physicians. They advised the CDC. They unanimously voted to recommend the vaccine, and the CDC now recommends it. So this is all good news. The FDA, the CDC, we've discussed it with our own vaccine subcommittee, our own local group of experts here in the state of Rhode Island who were also recommended it for use. And we are ready to go in the state of Rhode Island to vaccinate adolescents. So to remind people, all adolescents can get registered for appointments at vaccinateri.org. And that includes all of our mass vaccination sites. You can actually go on there. You can choose and specify the Pfizer vaccine specifically and get it at one of our state-sponsored sites. In addition, the Department of Health, as well as the Department of Education, in partnership with cities and towns and schools, are planning to have vaccination clinics at middle schools throughout the state starting early next week. They will be scheduled during the weekend and after work hours to make it easier for parents and guardians to accompany kids. On a personal note, I will say that my daughter, I live here in the town of Lincoln. My daughter is 13 years old, and I did sign her up to be vaccinated this Saturday at the Dunkin' Donuts Center. So I'm excited about that. I discussed it with her. She wanted to be vaccinated. So she is going to be vaccinated this Saturday. So I just share that as a as a lesson and as a model to let everyone know that I'm going to vaccinate my own kids as well, and I believe in the safety and the efficacy of this. I will also say, just on a note, some other questions that we have been asked is that we are requiring parental guardian permission for 12 to 15-year-olds. So if you are a 12 to 15-year-old, you will be required to have parent or guardian permission. Similar to other medical care here in the state of Rhode Island, 16 and 17-year-olds are strongly encouraged to discuss with parents before receiving their vaccine, but 16 and 17-year-olds can consent to their own medical care in general, as well as for these vaccines. So I'm going to stop there, but I am absolutely happy to answer any questions that people may have about the COVID vaccine, Pfizer specifically for adolescents, and really about anything in general. So thank you very much for joining us, and I'm happy to take any questions here.
So there's a question from Jessica Piccolo. She's asking, how long has the trial been going on for adolescents?
It's a great question. I want to say between 3 to 6 months. I'd have to look up exactly. Again, in the initial Pfizer studies, they enrolled, I believe it was around 30,000 people. So it's been tens of thousands of people all told. And then the trial for adolescents has been going on for months. And I can get back to you with an actual time frame on that for sure. And again, they'll be followed for 2 years.
Thank you, Dr. Chan. And another question from Denise, who says that she has a question regarding the vaccine and food allergies, specifically allergies to nuts and shellfish. Should she get her son the vaccine, and what are his risks of anaphylactic reaction as someone who has food allergies to nuts and shellfish?
Yep, that is a phenomenal question. And we've gotten that question a lot in general, not just for younger adults, adolescents, but also for adults. And the answer is that people who have a known allergy to a component of the vaccine obviously shouldn't get the COVID vaccines. If they've received a first dose of the COVID vaccines and had an anaphylactic reaction, then they should not get the second dose. And anaphylaxis refers to a severe allergy, right? Where people start to get hives and their throat starts to close up. And it's really a severe, severe allergy. It's treated and people do well in general, but it is a medical emergency because people's airways can swell up. So for people that have allergies to other things, it is not a contraindication to getting the Pfizer vaccine, meaning that you should get it or strongly consider it. At this point, we have vaccinated many, many people who have other allergies, and uniformly, they've all done well. I would say if you have any questions, though, please do check in with your pediatrician, primary care provider, or even an allergist. And again, so people, there are a number of people out there with multiple allergies, and even people with multiple allergies to food, to other medications. In general, they've done well with these vaccines. These vaccines are very, they're not complex. They have, when you talk about the Pfizer vaccine, you have a strand of RNA, remembering, of course, that our entire body every single cell in our body contains RNA. It's surrounded by lipid molecules. And then there's some solution, some very common agents in solution that allow it obviously to have liquid form. So there's not a lot in these vaccines for people to react to, and people as a whole have done really well.
Thanks, Dr. Chan. Stephanie asks, what about the no mask guidance now for vaccinated people? How will this be implemented out in public indoors?
Great question. So this just came out today. The CDC saying that if you are fully vaccinated, you don't need to wear a mask indoors. So I will say that it was just released today. We're in the process of synthesizing and digesting it and determining the risk and the balance. So please stay tuned. We'll have more on that in the near future. I will say, though, one comment on that is just that these vaccines are incredibly effective, but they're not 100% in preventing infection. I mentioned for adolescents that the data on 2,200 individuals is that they're 100% effective in preventing sickness. So people don't get sick, have a much, much, much lower risk of getting sick, and they prevent people from being infected, but they're not 100% at preventing people from being infected. And so the point of that is just to say that there's still a small risk, even if you've been vaccinated, that you may have asymptomatic infection or very mild infection. And so that's why at this time, given that there's still some circulating COVID, of course, is that even if you're vaccinated, people still need to be a little bit careful. Now we're approaching a point where we're obviously moving back on all these restrictions, but just want to encourage people who are listening that there's still some degree of caution that's warranted while there's still some COVID circulating. And so what does that mean? It means, obviously follow our current recommendations in terms of masking and physical distancing, but just you want to still avoid things like large crowds, especially large crowds indoors. If you're sick, you want to not go out. If you have respiratory symptoms, you still want to stay at home and encourage others to do so. So still following the guidance that we at the Department of Health and CDC have released about just being a little bit careful. I do think we're almost there, and I think we'll be there very, very soon. But just encouraging people in this time frame to just still be a little bit cautious.
Great. And Ronald has a similar question. What do you think about the new CDC mask guidelines?
I think, so again, I just briefly reviewed them today. My understanding is that they're saying that if you're vaccinated, you don't need to mask indoors. I think that if you are vaccinated, you are going to be protected. Again, what I worry about is not, as someone who's been vaccinated, I don't worry about myself at all. I worry about other people. So for example, as a physician, even though I'm feeling 100% right now, I still mask when I see patients indoors in exam rooms, just because of the off chance that I may have asymptomatic infection and obviously potentially transmit to that patient in front of me. And so at least for myself and my thinking on this, if you're vaccinated, you are going to be good. But it's really about thinking about other people around you, those that may be older, more vulnerable, that you really want to be more careful. And so my personal opinion and where we're going to be headed in the future, and we're again discussing this, is going to be is if you're indoors with other vaccinated people, the risk is, approaching zero. But if you are vaccinated and you're indoors with other potentially older people, of course, who may not be vaccinated, or potentially even indoors with people who may be immunocompromised, remembering, of course, the vaccine may not take in some people that will not mount an immune system, you still want to be a little bit careful about masking indoors, in my opinion. And that's to the point that thinking about out of everything we can do is really doing stuff outside is the best. Outside with that, it's just, you can't replace being outdoors. And that's why the masking restrictions on outdoor stuff was lifted. And I think what we've learned during the pandemic is that being outdoors is just so protective, so much better. And it's really those closed indoor spaces that put you at risk of COVID because you're not circulating air, you're in close proximity of others. So I think we're moving to a place where people need to just, based on the lessons that we've all learned, is use a little bit of common sense in terms of thinking about the risks and interacting with people, especially in smaller indoor spaces. It's a good question, and to reiterate, we'll be discussing it in the near future, and we'll have some formal Department of Health guidance shortly.
Great, thanks. And just a follow-up question from Ronald. Should people in general still get tested weekly?
So people are vaccinated. I assume that that's what the question is getting at. I would say it depends. If you are engaging with people that may be at higher risk, I would say the answer would be that you should consider. So for example, if you're working in a nursing home, if you're working with older people, more people who have vulnerable to diseases, to infections, I think it's reasonable to consider being tested on a frequent basis. I'm not sure if it's a week, if it's a little bit longer, but it makes sense while there's still some circulating COVID in the community, which there is in Rhode Island and many other places in the US, is to still consider some degree of testing if you've been testing all along.
Great, thank you. And this is from Barbara Ann. She has had vertigo for decades now and is wondering if the shot will make her vertigo worse.
It's a good question. Sorry to hear about your vertigo. I definitely have a few patients with that, and it's not pleasant. There's no reason to think that the vaccine will exacerbate the vertigo. You should expect some symptoms, your immune system developing antibodies and some symptoms of, feeling malaise and arm pain and maybe even some low-grade fevers and chills. within the first day or two. In some people, that may exacerbate pre-existing conditions like vertigo, but it shouldn't have an effect after those few days, et cetera. I haven't personally heard of any stories of that or any patient cases.
Great. Sienna Katz has a question. When do you think a vaccine will be available for younger children? And then another question, should vaccinated parents still wear masks around unvaccinated kids?
Yep, all good questions. So Pfizer released as well a announcement last week that they plan to, for the Pfizer vaccine, to apply for FDA authorization in September for children, children under the age of 12. So I think we're looking at fall at the earliest, early fall, but fall nonetheless for COVID vaccines for children, and probably for Moderna and others, winter of 2020, if not early 2021. In regards to the question of should parents, vaccinated parents, mask around children, the answer I think is twofold. For your children, if that was the question, I would say no. I mean, I would consider a family unit a pod, right? And obviously I'm vaccinated. My kids, my 13 and 10-year-old are not vaccinated as of today. My daughter, again, is going to be vaccinated on Saturday. So we don't mask around each other. We're a family unit, a pod. If you are a person who's vaccinated, who's interacting with children on a regular basis, for example, a teacher, a childcare, I would consider, this time indoors, as of this moment, the answer would be yes, you should mask in that setting. So, again, part of masking is protecting yourself as well as preventing transmission to others.
Great. Chris is asking if Rhode Island is following the new CDC mask rules.
So the CDC, we are trying to follow CDC mask rules in general. I will say that that we will be looking at the CDC mask guidance.
Sherry has a comment. She says unvaccinated children will now be exposed. It's been only 2 days since 12 to 15-year-olds were able to be vaccinated. And she hopes that they are adequately protected. She says dropping masks indoors now leaves them so vulnerable. So that's Sherry's comments. I don't know if you have anything to share based on that comment.
Oh, say that once again, Patrick. I missed the question in that.
Sure. So Sherry says that unvaccinated children will now be exposed. She says it's only been 2 days since 12 to 15-year-olds were eligible for vaccination, and so she hopes that that children are adequately protected. Her concern is that dropping masks indoors now will leave them very vulnerable.
Yeah, I mean, it's a good point. So I would imagine that those are the exact situations that we'll look closely at for school settings where perhaps some of the classroom is vaccinated and others may be not. So those are the exact situations that we're going to take the CDC guidance that they just released and synthesize and apply it to lots of different situations. So please do stay tuned for more guidance.
Thank you. Ronald says that we're still seeing Rhode Islanders being hospitalized and even dying each day from COVID. He's wondering if we have a sense of how many of these people have been fully vaccinated.
That's a great question. In fact, we're in the process of looking at that data now. I will say what we've seen is that for fully vaccinated people, there's a much, much lower number of fully vaccinated people being admitted to the hospital. I will say, though, that it's not quite zero. And so we haven't looked exactly yet at the people that are hospitalized who have been fully vaccinated. I suspect though that they're a little bit older, they may be immunocompromised, and with any vaccine, and it's going to be the same with COVID vaccine, there's always a subset of people who tend to be older, who tend not to have robust immune systems, immunocompromised, where the vaccine just does not mount a strong response and people are still at risk of COVID. The good news is, again, that it's highly protective. We are not seeing a lot of hospitalizations in fully vaccinated people, but there are still a handful. And we will be releasing some of those numbers in the coming days here. Thank you. Good question.
Thanks, Dr. Chan. Jethro is asking if we'll have booster shots coming for COVID soon.
Another popular question. So the answer is maybe. So I'm optimistic, as we think about other infections and diseases, like the flu, for example, we need a shot every year. But I want to remind people that the flu is very different from COVID. If you look at what happens with a virus like the flu, you have entire portions of the flu virus which switch with each other. And so what that essentially does is create entire new flu viruses from year to year. That's not happening so far, knock on wood, that we can tell with COVID. With COVID, you get little point mutations, little mutations in a single point, a single base pair in the RNA, but you're not seeing these shifts that you see with something like flu. Therefore, I'm optimistic that while we may need in the future a booster, perhaps one, we should not need, say, a booster every year. I'm going to be optimistic about that. I'll say we don't know for sure, but based on what we've seen from the biology of COVID coronaviruses, I'm hopeful that we won't, but I don't know for sure.
Thanks, Dr. Chan. I don't see any other questions at this time. Did you have anything else you wanted to share with our audience?
I just want to encourage people again while we're on this. We've also received some questions in the last couple weeks, couple months, just about some misinformation and myths about the vaccine. So I want to again just mention that these vaccines do not cause infertility. They do not cause people to be sterile. They cannot give you COVID. They do not alter your DNA. And we now have almost a year worth of data that show that these vaccines are very safe. In fact, it was almost reassuring for the Johnson & Johnson vaccine that our current safety systems picked up 6 cases of severe clots that led to the Johnson & Johnson pause. Very rare, only 6 cases out of millions and millions administered. So that tells me again that these safety systems were working. So I just want to encourage people to rely on trusted sources of science, of data, of the vaccine. So talk to your primary care doctor, talk to your primary care provider. Look at places like the CDC, other reputable science sources, and try not to get your information from places like Facebook or Twitter, etc. And as we move along here, asking people who are listening, who feel comfortable, to really encourage people around them, whether or not it be others in their household, their neighbors, other people in the community, coworkers, to really strongly consider being vaccinated. And if you yourself or the people you talk to do not feel like that they're really at risk of COVID, and they may not be if they're younger, otherwise healthy, but just encouraging people in general to be vaccinated to protect all of us, and certainly the more vulnerable members of our community. Because again, all of us really want to put this behind us as soon as we can. And the path to get that done is really going to be vaccinating as many people as possible. So thank you again for listening, and please do reach out to us at the Department of Health if we can ever do anything.